to this edition of the Farrell Phelps Show. My guest today is Dr. Flash. Dr. Flash, welcome to the show.
Thank you. It's my pleasure to be here.
Oh, man. You know, I have really wanted to do this show for a very long period of time because the part of our show is to educate, motivate, and inspire. And we know that HIV is a very serious issue. It's happening in America when people that we know, friends, loved ones, and you are actually a specialist in HIV. And you, with Harris Health Systems is where you are a doctor. You're also an assistant professor at Baylor College of Medicine. You have a lot going on, and you have a lot to offer. I want to talk about HIV. Let me ask you this first. I think there's a lot of misconceptions as to how it's contracted. How is HIV contracted?
Okay. So I think that this is a very important question because a lot of people have misconceptions about how HIV is transmitted. And they think that you can get it from touching someone's hand or drinking after them or eating from their fork or using the same bathroom as them. And none of those things are true. HIV is only transmitted by blood-to-blood contact or contact with sexual fluids. Right? And through mother-to-child transmission, like when a mother is having a baby, it can be transmitted in that way as well. So unless you're contacting someone's blood, actually contacting your blood, so you have to have an open sore and they're bleeding into you
for that to
happen,
place.
right? Or you're having intimacy with that person, or you're engaged in sharing drug paraphernalia with someone or something of that nature. Those are the ways that HIV is transmitted. And so with that in mind, it's a fully preventable illness because most of those types of contacts can be controlled through the use of condoms, through using safe equipment, or through not using drugs
at all,
right?
Yeah.
Because things like blood transfusions and things we used to worry about years ago, though theoretically there's a risk, our blood system in the United States is screened appropriately, and so that's not really a significant risk. So the real ways that people can get it are things that are completely controllable and preventable.
Really? Okay. Because I know that used to be a big fear when people were getting blood transfusions and things of that nature. They automatically had a fear, thinking, okay, this is a risk that I'm taking with getting something.
Absolutely.
And now isn't there an incubation period also? If it's contracted, that it may not be detectable? Well,
that's true to a point. When someone's initially infected with HIV, there are different types of tests someone can do to investigate whether or not someone has become infected or not. And the kind of HIV test that we usually start with is called an antibody test. And so that tells you that your body has noticed it has an infection and has started to mount a protective response. So it can take 4 to 6 weeks for your body to show evidence that it has encountered this disease and become infected. And so it can take some time. So if someone has an encounter on Monday and goes and get a test on Wednesday, that test on Wednesday says nothing about the exposure. The test they have in 4 to 6 weeks may tell them whether or not they've been infected. The thing to know, though, is if you know that you have been exposed to someone who is HIV infected in the manners that we spoke of, which is how it's transmitted, there are ways we can figure it out faster. Right? There are new tests, 4th generation tests, where you can find out as soon as 2 weeks. There are other things that I can do to figure it out within 5 days of an exposure, to do viral load testing. So there are ways you can figure it out really quickly, but you have to have those conversations with your clinician, right? If you just go and say, oh, I just need an HIV test, and you don't really tell them that this was a recent exposure, they won't do the right tests. And then you'll have a false sense of security because you won't know that something actually happened. And I think that's almost the most dangerous part.
Right. Yeah. And I think there's an embarrassment. I think that's a lot of times that's associated with getting that disease too, and the stigma that's attached to it as well. So a lot of times I think when people go to the doctors, they aren't willing to necessarily tell the whole truth.
That's right.
And so you're not necessarily looking for particular things because you've not gotten the whole truth.
That's right.
In that situation. So I think it's important that we communicate effectively with our doctors and our physicians so that you guys would know how to better work with that particular patient.
And I think I hear from patients when they come to me and they've already been infected, they'll say, well, I would go to the doctor and they would test me for everything. No doctor's testing you for everything. There are hundreds and hundreds and hundreds of things to test. You have no blood left in your body if we tested you for everything.
By the time you
yes.
finish.
And often There's so much stigma associated with HIV. Sometimes even when people get tested for other sexually transmitted infections like gonorrhea and chlamydia and syphilis, sometimes they're not tested for HIV at the same time. And so sometimes you have to educate your provider and say, listen, did you test me for HIV? Because I really want to make sure that I don't have any of these things that are, controllable here. And you have to ask the question instead of assuming that because you got a bunch of tubes of blood drawn that you got tested for everything.
Right. So we need to be very specific when we go in to be tested and say that I want an HIV test.
Absolutely. Have that conversation. Be empowered.
Yes.
Be empowered to have conversations with your physician about what's going on in your life and what your needs are so they can help you stay safe.
Absolutely. And I want to ask you too, once a person knows that they're HIV positive, once that's been detected, what type of treatments are now available for that particular, to treat HIV now?
So HIV treatment has changed so much since the 80s. I tell patients, when they think of HIV, they think about the movie Philadelphia, and they think about someone who's so skinny and has rashes and their life is falling apart.
Right.
And I said, it is not 1980 anymore, right? The medications to treat HIV are much more tolerable.
Okay.
They have much fewer side effects. The amount of pills, it used to be when you were infected with HIV, you would take a handful of medications. Who wants to do that, right? You call it a cocktail, but no one wants a cocktail that looks like a handful of pills.
Right.
I have patients whose HIV is controlled with one tablet once a day, right? And so it doesn't get a lot easier than that. One tablet once a day. And for many of them, they experience either zero side effects or very mild side effects. A little nausea the first couple of days, your body knows you have something new in your system. And then after that, it's easy breezy. But I think that in the community, there's so much misperception in people's minds about what getting treated for HIV looks like that they shy away from getting treated when it can be very simple. It can be very simple.
And certainly add years to their lives.
Oh my goodness.
When they actually take the medicines the way that they're supposed to take the medicines.
Absolutely. So, the data shows now that people on treatment for HIV will live within 5 years of their life expectancy. So for example, my grandmother lived until she was 95 and my grandfather lived until he was 90. So let's say that 93 is what's normal in my life. I have good genes, right? So that means that even with HIV on medication, I would live until I was 85 or 87, right?
Okay.
So I would live within 5 years of what's normal for my family.
Yes.
So that's life-changing. That's
Absolutely.
life-changing.
Yeah, because I think oftentimes it's considered a demise. Once you get it, it's truly considered a death sentence for a lot of people. And today, with all of the new meds, that belief can be dispelled now.
That's right. It doesn't have to be. It becomes a death sentence when you hide away and when you allow the stigma from the community and internalized stigma, right? The stigma we have against ourselves about how I got this, or what will people think, or what will people think about my children or my family, that prevents us from going and getting care. Those are the things that are a death sentence, right? It's the stigma that's a death sentence, because if you don't get on medication, yes, it'll look just like 1980, right? But if you get on medication and you get into care and you get this thing controlled, you'll have a normal, healthy life. I have patients where their HIV is the easiest part, right? Talking about quitting smoking and losing weight and exercising, that's the hard part. I say, listen, if I can keep you from getting a heart attack because you need to lose 70 pounds, right? That is the harder conversation, the harder thing to navigate than taking this one pill and making sure that, that they're safe on it.
Yeah. Man, you know what? We're getting so much good information. I thank you so much. We're going to be back with more information in Dr. Flash in just a moment. You guys stick around. We'll be back. All right, welcome back to this edition of the Phil Phelps Show with my guest today, Dr. Flash. Welcome back, Dr. Flash.
Thank you.
You know, we're having such good dialogue. I know people are certainly being educated about HIV awareness, which is so important because this could save lives.
Absolutely.
This could definitely save lives. I wanted to also ask you, too, when a person might be in early stages, perhaps, or whatever, how do they, what types of symptoms, I guess I would say, might a person see that might make them alarmed, perhaps, and make them think that possibly something could be wrong? What are some of the symptoms, possibly, that one would see that may have contracted HIV before they've been diagnosed?
That is a very important question because HIV is sneaky, okay? When someone is initially infected with HIV, the symptoms feel a lot like the flu.
Okay.
Okay? So usually about 2 weeks after infection or so, someone will start to feel tired, they might have some low-grade fever, they might have swollen glands in the neck or in the armpit, they might get a little bit of a rash, just feel somewhat run down. Now, of course, other unusual things can happen. HIV is a great pretender, so some people have very dramatic presentations, but for most people, it's not like that. For most people, it feels like a little viral syndrome. Like those of us who are workaholics, we might not even have taken the day off from work for the degree of symptoms that you had, right? A little bit of headache, a little under the weather. You take some Tylenol, you keep going. Then after a couple of days, that initial set of symptoms will pass. That's called your acute viral syndrome, and that goes away.
Okay.
Especially if someone was fully healthy before, and it's usually infecting a lot of young people, and so they had no other medical problems, they can go for years without having additional symptoms. They can go for as much as 10 years, and in that time frame, the virus is somewhat quiescent. It's quiet, right? But as the virus attacks our immune system and we get weaker and weaker, you start getting symptoms, but it's subtle because it doesn't happen wham all of a sudden, right? Little by little, your immune system gets weaker, and then you notice, man, I'm getting bronchitis all the time. I'm getting pneumonia all the time. I always seem to be getting the flu. I have a rash I can't get rid of. I have these infections I just can't get rid of. And so I'm starting to lose weight without trying. Right? And so subtle things start happening after 10 years or so of infection, and that's when sometimes that's when they present, right? Because now they're really feeling it. They're like, man, I just can't get better.
It's showing up.
And then you diagnose them, but often by that time, the person has progressed to AIDS, right? And so it's late. And so that's why we can't just depend on symptoms. Right? I'm not at all saying that every time you get the flu or every time you get a little cold, you have to go running to the doctor. What I'm saying is that people need to just get tested regularly, say once a year, so that you won't get surprised. You don't have that 10 years where you thought everything was right, and then all of a sudden it's not. Right? So you just want to get tested every year, depending on what's going on in your life. For some people, if they're having very high-risk activity in their lives, some people need to get tested every 3 months. Right? Because the sooner you get diagnosed, the sooner you can get on medication, and the longer you'll live, and you don't ever have to feel those horrible symptoms. I have patients, I diagnose them really quickly, and they never have to experience the horrors of AIDS or of having long-term HIV. They can have normal lives if we can diagnose them quickly. And even more importantly, when you get on medication early, it makes it harder for you to transmit virus to other people.
Really?
So getting treated early actually protects the people around you and the people that you're in intimate relationship with from getting infected. We still recommend condoms, but just having very well-controlled virus also decreases the risk of transmission.
Is that right?
Yeah.
Now, see, I never would have known that. I would have thought simply because you do have it, and it would naturally, whoever you're in contact with unprotected, I never knew that it would actually decrease. No, that's good information.
Yes, we call it treatment as prevention, right?
Yeah.
So when I get someone on treatment, it does miracles for that individual who is infected, but it also is serving the community as well, because if I can get the level of virus in each drop of their blood to a level that's an undetectable level, it doesn't mean they're cured. But it does mean that their virus is under perfect, exquisite control. And that alone brings down the risk of transmission by 96%. That's enormous.
Wow.
Right? And so if you have perfectly controlled virus and you're utilizing condoms, your risk of passing virus onto another person is very close to zero. And so we try to tell people that this doesn't mean, not only is it not a death sentence,
Okay.
but it also isn't, being put into solitary confinement. Right? Some people say, listen, I'm never going to have an intimate relationship again because I have this diagnosis.
Right.
And I try to tell people, no, that's not necessarily the case. Get into care, get things controlled, learn what you need to know to protect yourself and your partner,
Right.
and you can have a normal life.
And I think a lot of times people feel like that part of their life is over.
Right.
And I think also it's important that you tell people that you're with. And I think
Absolutely.
that's another way that HIV is spread, because people are not being honest about having it. And so they're continuing to have this sex unprotected and not sharing that information.
That's right. And so I empower people. One of the things, we have an HIV prevention program in Harris Health System, and one of the things that we talk to people is, how do they navigate that conversation? How do you have the conversation with someone, have you ever been tested for HIV? And listen, let's talk about using condoms. Or, who else are you with other than me? Like, how do you bring that up?
Right.
And we also talk to people about some new and exciting modes of prevention as well that are available, something called PrEP, which I'm sure we'll talk about a little bit.
Oh yeah, we're definitely going to talk about that. I'm really being educated so much, and that's what I wanted to take place on today. I wanted education not only for myself, but for the viewers, because what we're talking about actually will save lives.
Absolutely.
It will actually save
Undoubtedly.
lives. Now, tell me what you think of this. If you're meeting someone and you just began dating, and you want to have that conversation, and that person might say, okay, I'm HIV negative, or I'm fine, or it's just you, or whatever, and do you necessarily trust that conversation, or is it best for you to have a doctor's visit along with that person and both you guys get tested at the same time?
Okay. Well, I think that there is no one shoe fits every situation,
Okay.
right? I think that it's important to have that conversation, right? Don't just let the music get slow and the lights get low and no talking transpire, right? And so have the conversation, try to navigate condom use. And also, couples testing or getting tested together is excellent, because, not only does it give you the opportunity to find out if the person has HIV, but also, do they have gonorrhea, do they have chlamydia, do they have syphilis, do they have all these other things that, perhaps you don't want those either, right? And then the other thing is, sometimes the person with HIV, it's hard for them to disclose. It's hard for them to tell someone. And that might seem shocking. How could someone have this illness and not tell someone? But it's hard. But by going and saying, let's get tested together, you give a space for that conversation. They say, oh, well, what happened was, I have this. You're right. So you force the conversation. And it's important. Not everyone breaks up after they find out their partner's HIV positive.
Okay. Yeah, so I guess you can. What we'll say is that they can have successful relationships in spite of.
That's right, but you have to know, right? For it to be a success, you have to know what's going on.
You have to know, and you have to be honest with the person that you're
right.
with, and you have to care enough about that person to want to save their life or to want to spare them from what you've experienced and gone through.
Absolutely.
And so that is certainly, I would say, the key. You
can't assume, you can't put control over your own future in the hands of your sexual partner, right? We as individuals need to be empowered to protect ourselves and not always say, well, he or she has my best interest in mind, right? Nobody has your best interest in mind except you. You have to kind of go forward with that. Even though you're in love, right? Get tested. Let's talk about condoms. Let's talk about, where you've been, who you've been with, and what's going on, right? And so have those important conversations that I think make relationships stronger.
Absolutely. And being honest and having that integrity is always the key.
Absolutely.
I'm enjoying this dialogue so much. I have to keep saying that. We're going to be back in just a moment. You guys stick around. All right, welcome back to this edition of the Farrell Phelps Show with my wonderful guest today, Dr. Flash. Welcome back, Dr. Flash.
Thank you.
You know, we are learning so much about HIV and AIDS, and I wanted to ask you in the segment before, and it kind of slipped me, the difference between HIV and AIDS.
Oh, okay.
Because oftentimes people think that one is the other.
That's right. So it's very interesting. HIV is a virus, and the virus is what causes an infection, right? And so when someone becomes infected, they are infected with the virus, the human immunodeficiency virus, and you call that being HIV infected or being HIV positive.
Okay.
Now, the virus can cause people to feel flu-like and get a rash and do these things to your body, but what it likes to do is it likes to attack people's immune system. And when it attacks that immune system, those fighter white blood cells that protect us from infection, and it gets weaker and weaker and weaker, when it gets to a certain threshold, that's when you call it AIDS. So we talk about specific cells or T cells that the virus are the cells that the virus likes to attack.
Okay.
And when those T cells get less than 200, that's when you're now at risk of getting unusual infections. They're called opportunistic infections, which is just doctor speak for infections taking the opportunity to get you when your immune system has been weakened. And that's AIDS.
Okay. Okay.
So AIDS is the progression of HIV.
It's a progression of HIV. So let's say, for instance, you have the virus, and then you get the HIV or the
you get AIDS, progress to AIDS.
Progress to AIDS. So once if you get on meds and you're taking the meds, and that's increased, then would you go back to the status of saying HIV?
So that is a very interesting question. Right now, once someone has reached a threshold where they've become so sick that they have received that label of AIDS, you don't get rid of the label.
Okay.
Even if you get to a completely healthy, you're out going to the gym, lifting weights, looking beautiful and doing everything, once you have AIDS, you always have that label of AIDS.
Okay.
The way that science is now. Because if you were to stop taking your medication over a period of time, you would go right back down to that point. Okay? I have to say, though, that patients that have been living with HIV, sometimes we have to remind them, I remind my patients that AIDS is not who you are, right? AIDS is a label, right? But a label is not what defines you. And so sometimes we're so bothered by, oh, this person, they have AIDS, ooh. And I'm like, well, you know, do they have a weakened immune system? Then okay, yes, maybe it is, ooh. But if they're doing really well, just because they have that label of AIDS, if they're doing well, who cares? It's a label. It's a label that just tells me if you stop taking your meds, okay, we got to pay attention and do things to try to protect you from getting unusual infections. But if you're taking your medication, it doesn't. It's just a label.
Okay. You know, and that's important for people to know. That's important for people to know that this one thing does not define your entire life.
It does not.
And I think a lot of times what we hear is that once we get this, it's just like, that's it for us. You know, and it defines every part of who we are. And it's not. There's so much more to us than the illness. It's like, say, for instance, you have a cold. Right. Of course there's a difference between the cold and HIV, but you have a cold, and so you'll take meds to get better.
That's right.
And I think when you look at HIV and AIDS in that manner, it helps you to see it from a different perspective. Okay, this is what I may have, so let me take these meds so that I can be okay.
That's right.
And get healthy again.
That's right.
You know, that type of thing.
If you have, you know, high blood pressure, you don't walk around saying, I'm an hypertensive. Right?
Exactly.
Exactly.
Yeah.
No, you don't. You are a person that has high blood pressure that needs medication to bring that blood pressure down. The same way with HIV, you're not defined by the virus, you're a person that has HIV. And if you take your medications, that will be well controlled. And you're still that person with all the potential that you had before.
Right. And that's so good. I think when you're able to look at it from a different perspective, it helps you to live a healthier life.
That's right.
And a better life. You know, and when we're talking about, there's a lot of advancements actually that people are not aware of for HIV now, and also to prevent it. Now, the name of the medicine that we can actually take a medicine now.
That's right.
That actually can, if you don't have HIV, the medicine will actually keep you from getting it. And I found that to be very interesting.
Yes.
But tell us a little bit more about that.
Okay, so this is one of, I think, the most exciting things in the world of HIV of late. It's something called PrEP, or pre-exposure prophylaxis. It's the use of a medication that used to be part of HIV drugged cocktails. So you would take this medication with other medications to treat people with HIV. About 3 years ago or so, we discovered that that medication taken alone by people who are at excess risk of getting infected, so people that are at risk, if they take it every day, it could protect them from getting infected. And so it's life-changing. It's life-changing for people that are in a relationship with someone and the person's HIV infected and their virus isn't yet controlled. What do I do now? How do I protect myself?
Yeah.
Right? I've been married for 10 years and maybe this would be very changing for our relationship if the intimacy all went away. Many of those people now get on PrEP. Right? The medication it has 2 ingredients, tricytidine and tenofovir, and the drug name is Truvada.
Okay.
Together, that pill is called PrEP. And I have patients who, women who say, listen, I'm in love with this person and I want to have a child. And this is the only person that I love, but they have HIV. What do I do? So we can use PrEP to have women be able to have children safely without getting themselves or their infant infected.
Really?
Yes. You have other people who they have, a higher risk lifestyle. They just think they're popular, but scientists will say that they're high risk. And so is there something that they can do to protect themselves as well? Yes, this 1 tablet once a day can protect people from becoming infected. And I think that's going to change the face of the HIV epidemic in the United States if we can get the word out.
That is interesting. And that's what this is all about, getting the word out and educating people.
That's right.
Because so few people knew about it. And it wasn't until I began to do the research for the show that I learned about it. And I was like, this is something that I definitely have to mention and bring up so that we can educate people about this particular thing. Now, what scared me about that was that would it be like perhaps would it increase promiscuity? Because we feel like, oh, I can do this, that, and the other unprotected now because I'm saved by this. Or how do you look at that?
That is a great question. So I would call that risk compensation. So you have something to protect yourself. So now you're like, oh, I'm free now. Put my hair down. People who are going to have risky sex, they are having risky sex whether they're on PrEP or whether they're not on PrEP. In the same way that when the birth control pill came to the fore, people said, oh, women are going to be wild and crazy because now they have this tablet they can take that will protect them from becoming pregnant. That's not true. If they're going to be wild and crazy, they're going to be wild and crazy, right?
Regardless.
And so they're either going to be wild and crazy and have a couple of babies or be wild and crazy and not have a couple of babies. So PrEP is also like that, right? Someone who's being wild and crazy, they're being wild and crazy. And so you can say, go be wild and crazy and we're not going to tell you about PrEP. We're not going to tell you about condoms. We're not going to tell you about getting your HIV infected partner in care. Or we can stop the foolishness and talk about the resources that we have available to us and allow people to protect themselves in the space that they're in. I still talk to people about safe sex and condoms and having conversations with their partners because PrEP does not protect you from gonorrhea, chlamydia, syphilis, herpes, HPV. How long do you want me to go, right? And condoms are important and partner selection is still important, but you don't have to add HIV on top of that list.
Got you. Well, and that was very important that you said that too, about the other diseases that you can get. So we're not just protecting ourselves from HIV or possibly getting, we're protecting ourselves from other things because PrEP does not protect against syphilis, gonorrhea, chlamydia, and things of that nature. So it's important that you guys know that about PrEP, but it does prevent you from getting HIV, and that's when you don't have it already and you take it as a preventative measure.
Absolutely.
Just to be sure.
That's to be clear, right.
Okay.
PrEP is not a cure for HIV. PrEP is something that's taken by someone who doesn't have it, but is at risk to protect them from becoming infected.
I think that's going to make a big difference in the world, needless to say, by people being protected. Now, and speaking of being protected, we want to talk a little bit about Magic Johnson, who has certainly been on the forefront of HIV, being a high-profile person. And many people have heard different stories as it relates to Magic Johnson being cured, and oftentimes it's associated with his wealth, thinking that, oh, he has the money to get cured, whereas the average person may not. But in fact, he is not actually cured. from what I've understood. It's just that his viral load is undetectable. Is that correct?
Perfect. Look at this education he's got here. That's perfect.
Got to get ready for the show.
That's right. Magic Johnson. You know, it's really a shame that when we look at someone who's doing well with HIV infection, we assume that means that they're cured. Because he is the poster child for what it looks like to live with HIV today and have a healthy, full, complete life, impacting your community in a positive way. And so we have to shift that messaging. No, he's not cured. He's been infected for 20 years, and he's taking excellent medications, and his virus is very well controlled. And that is a poster child for if you take your medications and you're in care, you'll do well. And you don't have to have millions to do this, especially in the United States, but increasingly around the world. Medications are often subsidized, you know, through the Ryan White Care Act. Care can be in Houston and in Harris County. Care can be accessed through Harris Health System for people who don't have insurance or who are underinsured. There is no reason that in the United States any person with HIV can't have the healthy, fulfilled life. I can't give you as much money as Magic Johnson, but I can give you a healthy and fulfilled life.
Yeah, and that is so important that people can live those types of lives. Even when they get that type of news,
That's
you
right.
can certainly live a good, healthy, whole life. Man, this conversation, like I said a minute ago, is fantastic, and I know it's educating people out there. We're going to be back in just a moment with a little bit more of Dr. Flash. All right, we'll be back in just a moment. All right, welcome back to this edition of the Farrell Phelps Show with my guest, Dr. Flash. We are having such good dialogue and being so well educated about this subject because of you.
Oh, thank you.
And I can't thank you enough for coming on to have this type of conversation.
My pleasure.
To make a difference in the world. Truly to make a difference in the world. We're talking about HIV and AIDS. We know that you're a specialist and you just blessed us right now. You know, we've all been so blessed. Now, when we talk about HIV and AIDS, there's a growing epidemic with senior citizens. Isn't there currently taking place? And then the others that are at risk are
Our younger people.
our younger generation as well.
Generation. So in the United States, about 50,000 people, a little less than 50,000 people get infected with HIV each year. And over the last few years, actually, those numbers have started to come down a little bit, but still, it's been pretty steady, over 40,000 over the past several years. Now, a lot of the advances are happening in certain populations and not in others, right? And so a lot of excess infection, or there's a lot of infection, particularly among young people between the ages of 15 and 24, particularly young,
African American?
Yes, among
Okay.
African American men in particular, especially gay and bisexual men. In fact, recently the CDC put out data that 1 in every 2 gay men, black gay men, will be infected with HIV during their lifetime. And so that, for me, is heartbreaking and is a crisis situation. right? So we talk about social justice in communities of color. Well, that should be a social justice issue. That should break any of our hearts. Now, among young people, there have been some advances in increased infection, but also among elderly people. Now, in terms of raw numbers, there are more young people than older people that are infected with HIV. But it's a little scary that there are some, in certain communities, there are some upticks in the number of infections among people that are over 55. And so a population that might feel like, I'm fine, no one in my community has this, might be lulled into a false sense of complacency. So it's important that no matter what your age, or what you look like, or how much money you make, that you get tested. Right?
Yeah, that was really shocking to me to hear. Now I could see it among the youth, the younger generation, and things of that nature. But when you talk about senior citizens being, and it's just like, really, seniors? For some reason, you just think that they're past that. Not that they're past it, but you just wouldn't think it'd be an increase, especially with HIV and that type of thing.
You see, there are older people that are watching your show right now that are saying, young man, when you're my age, you'll be glad that that part of life hasn't completely ended.
Okay. Hence, these types of things are happening in the real world.
That's right.
Very.
I'm sorry.
It's perfectly okay. And I get that. I understand that. And so that's why there is an increase.
That's right. Because they might not be as used to navigating condoms, especially if their partners are in the same age range as them and they're not worried about unexpected pregnancy. And they might think, well, everyone here who I play bingo with, they all look clean, right? And so why should I do anything additional to protect myself?
Yeah.
And so the absence of condom use and the advent of medications like Viagra, right, create a kind of situation there where we need to also educate older people about the need to protect themselves and to get tested.
Wow. Wow. Yeah, and that's real talk. And that's what this is about. I wanted to also say, as far as therapy is concerned, once a person might realize, okay, I am now HIV infected, what about some type of psychological therapy for them to help them cope with dealing with the fact that they have HIV status at this time?
Oh, that's a very good question. I think that the state of mental health care in the United States is not where it should be. When we look at so many segments of social challenges that we're having, a lot of them stem from lack of good mental health for people. And sometimes the communities most in need are the ones who say, I'm not going there because if I get on this antidepressant or this anxiety medication, people are going to say that I'm crazy.
Yeah.
Right? And so also among patients with HIV, sometimes it can be very challenging. We have mental health services available, both psychologists and counselors and psychiatrists, but many patients won't avail themselves of the resources that are available to them because they either don't want to talk to anyone other than me, and I say, well, I'm not a psychiatrist. I'm happy to talk with you, but you may need more. And so other ways that people find support are when they find support networks in their community, that they're in a women's group, or they're in a men's group, or they're in an older person's group, or a younger person's group, or a couple's group, or whatever it is. So places where there are safe spaces where they can talk about their infection and how to navigate a healthy life. But if we could, deal with the issues of mental health in the U.S., I think a lot of things that we worry about would go away. If we don't get care.
Absolutely. I want to also ask you, how important is diet?
Oh, that's interesting. So it depends, right? So if someone has advanced AIDS and they've lost a lot of weight, we do try to have them have very calorically rich foods because as their body's trying to fight and help control virus, they lose lots and lots of weight and they waste away, right? But once someone's solidly on medication and they're doing well and they're gaining weight, sometimes we have the opposite problem where this person's been used to eating all this calorically dense food and taking Boost and Ensure and all this extra supplementation, and then I'm like, wait, hold on, you're going to get a whole new set of problems, high blood pressure and diabetes and cholesterol and all these other things.
Right.
And so having a balanced, healthy diet and doing exercise is very important for
Okay.
people with HIV as well, so that they don't develop a whole other set of problems.
Right, right. Oh, such good information. I want to ask you guys, is there a question from anybody here in the audience? I know that, Tony, you had a question.
Well, the quick question I have, what do you do when you be honest and you tell your family or friends that you have AIDS or HIV and they're not supporting you and they turn their back on you and you really need them? What do you do?
That is a really challenging situation when you trust your loved ones with sharing something that has rocked your world and they are not supportive of you. And that's the same thing that happens sometimes when a young man tells his mom that I think I'm gay, or a young girl tells her dad, oh, I had an oops and I'm pregnant. So all of these things, and when we most need our support system, so often they shun us. And that's why conversations like this are important, so that we can inform the community that you don't need to shun your loved one. You're not going to get infected by embracing them, catching their tears, cooking them a good meal, holding their hand in church, praying with them. That's not putting you at risk. And I think people, they don't realize what harm they're doing to their loved ones when they block them out. It does happen. But for the HIV infected person, you know, it can be hard to feel like you're an advocate, right? And so often, many of us were asked to be advocate for all kinds of things that we didn't really ask for. But by having the conversations and saying, look at me, I have this, and you didn't think so before you saw me, that reduces stigma. Because when you can put a face on it, when it's a brother, a sister, an aunt, a cousin, they're like, oh, I know so-and-so, and they have HIV, and actually, you know, they look okay. They look kind of like magic, right? It does so much to decrease stigma. It's something we have to work on as a community, especially in minority communities. That you hear that story, but it happens other places as well, where people are pushed aside when they don't get the support, which is why finding other support networks is very important, right? Other people that are infected who you can talk with and say, you know, how did you get where you are, and how did you survive this, and how do you navigate these conversations, and don't just go it alone in your closet.
Yeah. And I think that's a part of the problem, because so often everybody want to go into the closet because of how they'll be treated or talked to or talked about if people learn what's going on with them.
That's right.
But I think your real friends are going to be there for you. That's just how I feel about it. You can come with the most detrimental news and say, for instance, you do have HIV, but people that really love you and that are truly your friends, those people I feel will be there for you.
Oh, there are a lot of great stories,
You know?
where people thought people would run away, and they completely embraced them.
Did just the opposite.
That's
huh?
right, that's right. Spouses and children and best friends and pastors, people who come to appointments with our patients and are that support system, people that they thought they could never tell. I remember a young man telling me that he hadn't told anyone, and how close he was with his mother. And I said to him, I said, you know what, as sick as you got, you look a lot better now, but as sick as you got, I'm a mother. She knows.
Really?
She already knows, right? She knows. She's looking at her child and she knows something's wrong. And so why are you just not, you need to just have that conversation with her to give her the space to say, I knew something wasn't right, and to give her the space to love you, right? And so after he had that conversation with his mother, he was like a different person. Because she didn't run away, she didn't ostracize him, she embraced him and supported him and helped him do better with being faithful and taking his medications. And he felt renewed, because he has his mom back. So even sometimes when you're a grown up, it's good to have that support when you can get it.
Yeah.
So.
I think that's awesome. Yeah. And it's nothing like having that kind of love in your life.
That's right.
You know, and the love of your mother, and taking the risk of sharing that information, and for you to be embraced by the person who loves you the most. Absolutely. I think is certainly a beautiful thing. Now, how do people get more information about you, and if they want more information about AIDS and HIV and this type of thing?
Oh, so there are lots of excellent places where you can get information that is factual information. First of all, the CDC website, so cdc.gov, has excellent information about HIV rates in the community, about where you can get tested, where you can get care. So that's an excellent site. We also have a website called www.prephouston.org, and that also gives you information about HIV prevention. So those are two places among many, but those are reputable areas where you can get information about HIV and HIV prevention.
Fantastic. What a wonderful show. What an informative, educational show we've had today. Man, thank you guys so much for joining us on this edition of the Farrell Phelps Show. And for more information on me and the show, you can just certainly go to my website. Just go to farrellphelps.com. You'll see a way to contact us right there. You can also just email us by going to letstalkaboutit12tv@gmail.com. That's letstalkaboutit12tv@gmail.com. Until next time, we'll see you then.
HIV/AIDS has taken the lives of over 39 million people worldwide, despite our efforts to prevent, treat, and better understand it. But with 35 million people currently infected, what exactly is it, and are we close to a cure? To contract HIV, the virus must enter the bloodstream, and it's often transmitted from infected bodily fluids like blood, semen, vaginal fluids, or breast milk. Once inside the bloodstream, HIV targets a variety of cells, but most specifically the T helper cells, which are a type of white blood cell that play an essential role in our immune system and fighting infections. The outer envelope of HIV is covered in glycoproteins which mutate frequently, ultimately tricking the T cell receptors to not recognize the virus. Once attached to specific proteins on the T cell, it begins to fuse the membranes together and eventually enters the cell where it releases 2 viral RNA strands and 3 essential replication enzymes. Because HIV is a retrovirus, the RNA is transcribed into DNA, represented here by a zipper of 2 RNA strands transcribing into DNA. This DNA is then integrated into the host cell's genome. This makes the T cells treat the viral genes like their own, which causes them to make more copies of the virus. These then leave the host cell and mature, ultimately seeking more T cells. The virus is particularly difficult to treat because its mutation rate is so high. Overall, the replication process creates more than 10 billion new virions each day. During these initial stages of replication, called the latency period, a person may not show any major symptoms for up to 8 years. If not treated, the HIV eventually kills off the specific T cells it infects. When these T cells fall below 200 cells per cubic millimeter of blood, it becomes acquired immune deficiency syndrome, or AIDS. After progressing this far, the immune system becomes suppressed and is much more susceptible to cancers and opportunistic infections such as pneumonia. A person doesn't die from AIDS, they actually die from an illness that the body could not fend off. Nowadays, there is medicine that helps fight these opportunistic infections, like Daraprim, which was recently in the news when Martin Shkreli of Turing Pharmaceutical decided to raise the price from $13.50 to $750 per pill. There are also antiretroviral drugs that slow the virus down by blocking certain enzymes which are required for the virus to multiply. Similarly, those without HIV but at high risk of contracting the virus may take pre-exposure prophylaxis, or PrEP. This works similar to antiretroviral drugs by blocking the enzyme reverse transcriptase. Thankfully, there is hope for a cure. A small population of people are immune to the HIV virus because of a mutation linked to the T cells. In one case, an HIV-positive subject received a bone marrow transplant, meaning they were given new stem cells that generate different T cells, and within 20 months, there was no evidence of the virus in their bloodstream. Though this is very individualized medicine, it certainly opens up the possibilities of generating HIV-resistant cells. Combine this with other therapies and preventative measures like condoms, clean needle programs, and safe blood transfusions, and HIV/AIDS may one day be a thing of the past. Your sharing of this video is much appreciated in the effort to help spread knowledge and awareness. And a special thanks to Audible for supporting this episode to give you a free 30-day trial at audible.com/ASAP. This week, we wanted to recommend the book Redefining Reality, which explores what is real and what is illusory from both a scientific and philosophical perspective through a series of really awesome lectures. You can get a free 30-day trial at audible.com/ASAP and choose from a massive selection. We love them as they're great when you're on the go. And subscribe for more weekly science videos.